Acute liver failure, also known as fulminant hepatic failure, is a rapid and severe deterioration of liver function that occurs within days or weeks in individuals with no pre-existing liver disease. Picture this: your liver, the powerhouse of your body's detoxification system, suddenly fails. It's a terrifying scenario, and unfortunately, it happens more often than you might think. This matter is serious for several reasons. Firstly, the liver plays a crucial role in filtering toxins from your bloodstream. If it malfunctions, these poisons can build up quickly and cause a series of potentially fatal issues. Secondly, acute liver failure can strike anyone, regardless of age or health status. The symptoms of acute liver failure can be subtle at first, making it easy to ignore until it's too late. Fatigue, nausea, and jaundice may seem like minor issues, but they can quickly accelerate into a medical emergency. But perhaps most importantly, acute liver failure is a race against time. Without prompt intervention, the chances of survival plummet. That's why awareness is key. By understanding the signs and seeking medical help early, lives can be saved. So join us as we explore the depths of acute liver failure and learn why it's a matter that demands our attention. 1. Viral hepatitis. Viral hepatitis is one of the leading causes of acute liver failure. Hepatitis A, B, C, D, and E are among the hepatitis viruses that can inflame the liver. Contact with contaminated blood or bodily fluids can result in the transmission of hepatitis B, C, D, and E. Usually tainted food or water is the source of hepatitis A. This may result from sharing needles, transferring from an infected mother to her child during childbirth, or having unprotected sex. These viruses cause inflammation and damage to liver cells once they have entered the host. Damage to the liver over time may result in liver failure, which is the inability of the liver to carry out essential processes, including removing toxins from the blood and making necessary proteins. Preventing viral hepatitis involves practicing good hygiene, getting vaccinated, using protection during sex, avoiding sharing needles, and being cautious when getting tattoos or piercings. 2. Liver injury caused by drugs. Numerous drugs, both OTC and prescription, have the potential to induce drug-induced liver injury. Some commonly known culprits include acetaminophen, certain antibiotics like amoxicillin, clavulinate, and even herbal supplements. When taking any drug, it's critical to carefully follow the dosage directions and be mindful of any possible adverse effects. Liver damage won't happen to everyone who takes these drugs. The way a person's liver responds to a specific medicine can be influenced by a number of factors, including general health, genetics, and the existence of other liver diseases. This highlights the importance of personalized healthcare and the need for doctors to consider individual risk factors when prescribing medications. Furthermore, certain individuals may be predisposed to DILI because of things like alcoholism or liver illness. Alcohol can exacerbate the liver's vulnerability to medication-induced damage, making it particularly important for those who drink alcohol regularly to be cautious when taking medications known to affect the liver. 3. Autoimmune hepatitis. Normally, the immune system's job is to defend the body against dangerous agents like viruses and bacteria. But with autoimmune hepatitis, the liver cells are mistakenly attacked by the immune system because it believes they are foreign invaders. The liver tissue sustains damage and becomes inflamed as a result of the continuous bombardment, which makes it less functional. Although the precise etiology of autoimmune hepatitis remains unclear, a confluence of immunological, environmental, and genetic variables is thought to be the cause. Genetic factors play a role to autoimmune hepatitis, as certain genes may make some individuals more susceptible to developing the condition. However, having these genes doesn't necessarily mean someone will develop autoimmune hepatitis, as other factors need to trigger the immune system to attack the liver. For those who are predisposed, environmental factors including infections or exposure to specific toxins can also cause autoimmune hepatitis. The autoimmune reaction in the liver can occasionally be brought on by infections such as hepatitis A, B, or C, as well as other viruses. Additionally, certain medications such as minocycline or nitrofurantoin have been associated with autoimmune hepatitis in some cases. Although autoimmune hepatitis can strike anyone of any age, women are more prone than men to contract it. Fatigue, jaundice, nausea, and soreness in the abdomen are common symptoms. If left untreated, autoimmune hepatitis can progress to acute liver failure. 4. Metabolic disorders. Conditions known as metabolic diseases impair the body's capacity to effectively metabolize nutrients and create energy. Some metabolic disorders can lead to acute liver failure by overloading the liver with toxins and causing it to fail quickly. One common metabolic disorder linked to acute liver failure is Wilson's disease. This condition causes copper to build up in the liver, damaging its cells and interfering with its normal functions. As a result, the liver can't work properly and may fail suddenly. Wilson's illness can arise on its own or is typically hereditary. Another metabolic disorder associated with acute liver failure is acute fatty liver disease during pregnancy. This condition typically occurs in pregnant women during the third trimester and is characterized by a buildup of fat in the liver. This fat accumulation can impair liver function, leading to acute liver failure. Acute fatty liver disease during pregnancy is a rare but dangerous disorder that needs to be treated right away. Additionally, certain metabolic disorders like hemochromatosis, a condition where the body absorbs too much iron, or alpha-1 antitrypsin deficiency, is a genetic disorder affecting the liver and lungs, can also contribute to acute liver failure. These conditions cause the liver's regular metabolic functions to be disrupted, which ultimately cause the liver to suddenly fail. Understanding the role of metabolic disorder in causing acute liver failure highlights the importance of early diagnosis and management of these conditions. 5. Ischemia. Ischemia happens when there is a lack of blood flow to the liver. This can occur due to various reasons, such as a blood clot blocking a blood vessel or a drop in blood pressure leading to reduced blood supply to the liver. The liver lacks the oxygen and nutrients it requires to function correctly when it doesn't get enough blood. As a result, the liver cells can become damaged or even die. This can happen quite quickly and contribute to acute liver failure. One aspect of ischemia-related acute liver failure is that it can sometimes be a complication of surgery. During certain surgeries, such as those involving the liver or nearby organs, there's a risk that blood flow to the liver can be temporarily disrupted. In extreme circumstances, this may result in ischemia and abrupt liver failure. Another factor that can contribute to ischemia-related acute liver failure is shock. Shock is a condition where the body's tissues don't get enough oxygen and nutrients due to a drop in blood pressure. When shock occurs, blood flow to vital organs like the liver can be compromised, leading to ischemia and potentially acute liver failure. Overall, ischemia is one of the causes of acute liver failure, and it underscores the importance of maintaining proper blood flow to the liver for its optimal functioning. 6. Acute Budd-Chiari syndrome. Acute Budd-Chiari syndrome is an uncommon but dangerous liver disease. When the liver's blood flow is obstructed, it occurs. Normally, the hepatic veins carry blood into the liver, but in Budd-Chiari syndrome, something stops this flow, leading to liver damage. Several things can cause this blockage. One common cause is blood clots in the hepatic veins. These clots can form for different reasons, like having a blood disorder or certain medications. A tumor pushing on the veins and obstructing blood flow could be another reason. In some cases, certain infections or inflammatory conditions can also lead to this syndrome. Abdominal pain, swelling, disorientation, and jaundice, a yellowing of the skin and eyes are signs of acute liver failure. It's important to diagnose and treat Budd-Chiari syndrome early to prevent severe liver damage. Treatment may involve medications to dissolve blood clots, procedures to open up blocked veins, or even liver transplantation in severe cases. 7. Eating poisonous wild mushrooms. One of the toxins found in certain wild mushrooms is called amatoxin. This toxin can cause severe liver damage, sometimes leading to liver failure within days of ingestion. Even consuming a small amount of certain poisonous mushrooms containing amatoxin can be deadly. Acute liver failure brought on by poisonous mushrooms can manifest as confusion, jaundice, nausea, vomiting, stomach discomfort, and even coma. These symptoms can develop rapidly after eating the mushrooms, often within 24 to 48 hours. If you suspect someone has eaten deadly mushrooms, you need to seek medical help immediately. Doctors can provide supportive care and in some cases, administer treatments such as activated charcoal or medications to help protect the liver and remove toxins from the body. Prevention is the best approach when it comes to avoiding acute liver failure from eating poisonous wild mushrooms. When mushroom picking in the wild, it's important to exercise caution because poisonous mushrooms can occasionally be mistaken for edible ones, even by skilled foragers. It's advised to avoid taking mushrooms if you are not convinced about their safety or to speak with a professional before doing so. Thank you for joining us on the journey toward a healthier you. Don't forget to subscribe and stay tuned for more empowering content on health date because your wellness deserves a daily date.